Cirrhosis represents advanced liver disease characterized by scarring and dysfunction. The condition progresses and generates specific complications that require targeted management approaches. Ascites. Ascites develops from portal hypertension, causing fluid accumulation in the peritoneal cavity. Management centers on sodium restriction and diuretic therapy. The standard treatment combines spironolactone, an aldosterone antagonist, with furosemide, a loop diuretic, to promote fluid removal. Albumin administration during large-volume paracentesis prevents circulatory dysfunction. Some patients require fluid intake restrictions to control fluid overload. Spontaneous bacterial peritonitis. Spontaneous bacterial peritonitis manifests as bacterial infection within ascitic fluid. Treatment begins with empiric antibiotics, particularly third-generation cephalosporins like cefotaxime or ceftriaxone or piperacillin-tazobactam. Albumin administration prevents circulatory dysfunction post-paracentesis. Secondary prevention involves prophylactic antibiotics such as norfloxacin to prevent recurrence. Hepatic encephalopathy. Hepatic encephalopathy occurs when neurotoxins accumulate in the bloodstream due to liver dysfunction. Treatment includes Lactulose, which promotes ammonia conversion to less toxic forms in the gut. Rifaximin modifies gut flora to reduce ammonia production. Branched-chain amino acids support brain function improvement. Polyethylene glycol treats acute episodes by promoting bowel movements and reducing ammonia levels. Portal hypertension and variceal bleeding. Portal hypertension increases esophageal and gastric variceal bleeding risk. Non-selective beta blockers, including propranolol and carvedilol, reduce portal pressure and prevent bleeding. Endoscopic interventions, such as band ligation and sclerotherapy, treat acute variceal bleeding. Hepatorenal syndrome. Hepatorenal syndrome presents as functional kidney failure in advanced liver disease. Treatment includes vasoconstrictors such as terlipressin, midodrine, and octreotide to improve renal blood flow and function. Dopamine supports blood pressure and renal perfusion. Severe cases may require noradrenaline administration.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.